Instructions to administer the medication. GONAL F 1050. Before administering the medication, read the following instructions carefully. Wash your hands properly before preparing and administering the medication. Try and choose somewhere clean and peaceful to prepare the medication. Make sure you have all the necessary material ready for the injection. At your pharmacy, you must get alcohol, medical gauze, and a suitable container to dispose of the material after using it. The medication that is kept in the refrigerator must be taken out 5 minutes before using it, so that it is at room temperature at the time of the injection. To improve the effect, try and administer the medication at approximately the same time every day, preferably at midday. Don't worry if there is a minor local reaction, such as redness, itching or pain in the injection site. That is normal due to the effect of some of the drugs used. If it lasts more than 24 hours, seek help at your UR group clinic. Once the medication has been administered, dispose of the material used in the container. If you have any questions, you should get in touch with your UR group clinic. The method to prepare and administer your medication is as follows. The GONAL F 1050 pack contains 1 vial of powder, a syringe pre-filled with solvent, 15 single-use syringes graduated in FSH units. Open the box and take out the contents. Open the seal of the packaging. Prepare the mixture in the following way. Remove the coloured plastic top off the vial of powder. Remove the top of the syringe pre-filled with solvent. Put the vial of powder on the preparation surface vertically. Stick the needle in the centre of the rubber stopper of the vial of powder. Slowly press down on the syringe plunger so that the liquid goes into the vial of powder. Try to make it flow along the wall of the vial to stop air bubbles forming. Once the syringe is empty, release the plunger so that it goes back into its original position. This is normal due to the extra pressure that was exerted in the vial. Take the syringe out of the vial. Gently move the vial with your hands to mix the contents. Do not shake it vigorously to prevent any air bubbles forming inside. Only use the single-use syringes included in the box to administer GONAL F 1050. Take one of the syringes out of the wrapping and remove the cap that protects the tip of the needle. Stick the needle in the centre of the rubber stopper of the vial. Put the vial upside down and pull the plunger to draw out the necessary amount required for the prescribed dose. If more than prescribed comes out, press down on the plunger until it reaches the correct dose. If air bubbles appear in the syringe, pull the syringe and gently tap it until the air comes to the top. Press down on the plunger to push the air out until a little drop appears on the tip of the needle and you have the prescribed dose. Take the syringe out of the vial. Now you are ready for the injection. The medication must be administered immediately after it has been prepared. Injection in the abdomen. The medication must be administered in the anterior area of the abdomen, about 3 fingers away from the navel. The injection site must be changed every day to improve absorption and to avoid any possible discomfort. Clean the injection site with medical gauze soaked in alcohol. Pinch the skin with one hand. Insert the needle completely, holding the bevel upwards at an angle of between 45 and 90 degrees to the skin. Inject the whole dose, pressing down on the plunger of the syringe slowly and constantly until it is empty. Wait for 5 seconds. First let go of the skin and then gently remove the needle. Apply pressure on the injection site with medical gauze for a few seconds and gently massage the area. This will favour the dispersal of the medication under the skin. If you have a suitable disposal container, put the used syringe in it without putting the caps on the needle. If you don't have a suitable container, put the caps back on the needle, being very careful not to prick your fingers, and keep it somewhere safe until you can take it to a UR group clinic, where we will be able to dispose of it for you. Remember that you must not reuse the needles or share them with anyone else. Keep the vial of GONAL F 1050 in the refrigerator between 2 and 8 degrees Celsius once you have made the mixture, and in its original packaging to protect it from the sun until the next time you use it.